I'm Lucy Keatts from the Wildlife Conservation Society, presenting on low pandemic emergence risk from northern wildlife use. The majority of emerging infectious diseases of humans are zoonotic, meaning they can be transmitted between animals and humans. Of these zoonoses, over 70% have wildlife origins. The COVID-19 pandemic has refocused attention on mechanisms that lead to zoonotic disease spillover and spread. Commercial wildlife trade chains and markets often represent high-risk interfaces due to the high wildlife-human contact rates and large numbers of admixed species in conditions that promote shedding and sharing of viruses. Growing recognition of these risks has led to an increased global conversation around reducing human disease risks from spillover associated with hunting, trade, and consumption of wild animals. These discussions are especially relevant to those who rely on harvesting wildlife to meet nutritional and cultural needs. Indigenous peoples and local communities across the boreal and Arctic regions have extensive and essential relationships with their environments, including through the harvest and sharing of wildlife, and global policies around wildlife use and trade can impact food sovereignty and security, especially of Indigenous peoples. To respond to northern food sovereignty concerns and apprehension expressed by researchers working with northern communities around potential routes for introduction of emerging zoonoses, we reviewed zoonotic pathogens of wildlife origin in Arctic and boreal systems in the context of wildlife use by northern communities. We considered the potential community and broader health implications of these zoonoses and explored the relevant dynamics of zoonotic pathogen spillover, amplification, and spread in northern biomes. The risk of zoonosis spillover from wildlife increases when wildlife-human and wildlife-domestic animal-human contact rates increase. Ecosystem degradation, land use change, and commercial wildlife markets all increase these contact rates and thus the risk of disease emergence, particularly when they occur in highly biodiverse areas. Arctic and boreal socio-ecological systems are currently less predisposed for novel zoonoses emergence, and our review found the threat of pandemic emergence from hunting, consumption, and use of wildlife in northern biomes is low. Policies restricting these traditional subsistence activities in the name of pandemic prevention would be misplaced. Health threats from endemic zoonoses remain, and environmental alterations from development and climate change will alter epidemic and pandemic risks. Monitoring, research, and response efforts will benefit from employing more inclusive One Health approaches that incorporate Indigenous knowledge systems and recognise the complexity and interrelatedness of the environmental, cultural, and socioeconomic dimensions of zoonotic disease emergence in Arctic and boreal systems. Community-based monitoring, participatory epidemiology, and citizen science are increasingly relevant as ways of centering research on community needs and priorities, providing northern communities with access and a voice in the research process to ensure that key questions are answered in a timely and relevant manner. Coupled with active and passive disease surveillance of wildlife and linked to transdisciplinary and transboundary One Health networks, further investment in these approaches will provide a more holistic view that strengthens the resilience of northern communities in these rapidly changing northern biomes.